Welcome back to SouFLoTV again, everybody. It is your host with the most. So the headline for this article says that the government of Jamaica has signed a U.S. $3.6 million agreement with the CDC, that is the Center for Disease Control. And this was reported on October 3rd, which is today that I am filming this of 2020. All right. Now, what does this mean? Given the way how news is dispersed to us, there are a million things being covered every hour on the hour, and we who have a normal working life, we don't have time to keep up. So this is where SouFLoTV comes in, because I go and find what I think piques the interest of the people, or piques my interest at least, and we dive on into it. So officials of the Ministry of Health and Wellness and the United States-based Centers for Disease Control and Prevention, or the CDC, on Thursday signed an agreement aimed at strengthening access to the delivery of quality services for prevention, for care, and for treatment of HIV and STIs, sexually transmitted infections. Now, at this point, people are saying, Lord, COVID is up on us, and we are battling with COVID alone with the whole social distancing thing. Wear a mask on your face everywhere you go. Half of the time you can't breathe, and all these other things. And now we must worry about this. A lot of people were wondering, what the hell was this deal about? 3.6 million US deal having something to do with our healthcare. You know, people are very skeptical at this point, because it could be vaccine, it could be anything that the people are fearing at this point. So I am going to clarify what it is about, okay? So the US $3.6 million 5-year agreement focus. All right, so this is what it's about. The US $3.6 million 5-year agreement will focus on supporting strategies for Jamaica's national HIV response under 3 programmatic areas: prevention, care and treatment, and strategic information and laboratory strengthening. Now, the document was signed by State Minister in the Ministry of Health and Wellness, Juliette Flynn, United States Ambassador to Jamaica, Donald Tapia, and the Director of the CDC Caribbean Regional Office, Dr. Varo Daide. In her remarks at the virtual ceremony, Flynn said that the agreement represents a significant partnership that will help to improve treatment, prevention, and care of persons living with HIV. Now, we're going to get into something else at a moment's notice, so just hang in there. With an estimated 32,600 persons living on the island of Jamaica with HIV, Jamaica accounts for 59% of the burden among the 4 countries supported by PEPFAR, or PEPFAR, which in other words is the President's Emergency Plan for AIDS Relief, Caribbean Regional Program. Now, Trinidad and Tobago, you have Barbados, and you have Guyana. They are the other countries involved in the program, she said. With such a high burden of HIV prevalence in comparison to its other Caribbean counterpart, Jamaica must intensify its effort to improve and transform the HIV response in order to reach the UNAIDS 90-90-90 targets by 2020. And I'm going to explain what the 90-90-90 means, and subsequently 95-95-95 by 2030. So if you're wondering what the 90-90-90 and the 95-95-95 means, the target states that by 2020, which is the year that we are in, some 90% of all the people who are living with HIV will actually know their HIV status, which means they will have been tested and they will know, therefore they can begin treatment and they can begin precautions, telling their partners that they're HIV positive, etc., etc., instead of walking around and passing this thing onto unsuspecting people. 90% of all persons with diagnosed HIV infections will receive sustained antiretroviral therapy, and that 90% of all individuals receiving or antiretroviral therapy will have viral suppression. There are drugs out there now that are so good as far as AIDS is concerned that it actually suppresses the disease within the system, so that when one goes to get a test, it actually comes up as a negative, right? There's more on this information out there, but as you know, in certain parts of the world, the medication is not free and it's very expensive for the average person. We can also go into talking about Jamaica's views on things as far as promiscuity. Promiscuity in Jamaica has become woven into our very culture. All these other things, the frivolousness of sex and sexual activity. And people are actually still going out to parties, the big street party them after dance, people drunk, people have sex in a bush, in a car, any which part them can get it. And usually they are running up into each other with no protection. So yes, Jamaica leads the Caribbean in HIV, AIDS, and it is said that in order for Jamaica to get on track, get under a program where we have majority of our citizens who are HIV positive documented and getting proper treatment, then they are going to have to step their game up tremendously. Now, please be reminded, I am taking this information directly from the Jamaica Observer, and it was printed today. Now, as far as Cuthbert Flynn pointed out that one of the unintended consequences of the COVID pandemic is that manageable chronic diseases such as HIV have received less attention and disruption in treatment and care, resulting in persons becoming uncontrolled. In other words, the focus has shifted to COVID. So where resources were going before to help people with diseases, chronic diseases that are manageable, those areas have now been neglected, right? She noted that the activities under this cooperation agreement will allow Jamaica to refocus and prioritize key actions that will help the country to meet the 90-90-90 targets. Now, the 90-90-90 targets was deadline to be met is 2020. We are in October. After October, we will have 2 months left in 2020 to meet that 90-90-90 goal. And by 2030, it's supposed to be 95-95-95. In all honesty, I do not think that they're going to be able to meet that goal in 2020. The goal is that 90% of those who are HIV positive will know their status. That means everybody in Jamaica who is HIV positive, 90% of them will know their status because they have been tested, and they will be going through the proper procedures to receive proper care, which can enhance quality of life. Now, for the first year of the agreement, some of these priority actions will include developing of the digital HIV/AIDS confidential reporting form and validating of data which indicates that 90% of all people living with the HIV know their HIV status. They will be carried out under the strategic information component of the project, the state minister said. Now, under the prevention, treatment and care component, the peer navigation training manual will be revised, and an orientation manual and toolkit for prevention staff developed. Additionally, social media will be utilized as an outreach tool to create linkage to testing and prevention. So they're going to put out commercials on social media as well. Hey, have you been tested? Yeah, me a gal is too, you know. I'm love enough woman and them thing that enjoying my life cause me young. But one day I had to become conscious. I realized that my health was compromised, so I went and got my test. I didn't just go check up at the doctor. I requested a HIV test. I now know my status, and I am now able to better my health by using whatever medication is out there. You too can prolong your life by knowing your status. Go get tested. That kind of stuff. Just encouraging peer groups to go and get tested. A backup machine for viral loading testing will be procured, and recency testing will be introduced. Ambassador Tapia said, the signing of the cooperation agreement demonstrated the strength of the bilateral relationship between Jamaica and the United States. He says, I am thrilled that we are strengthening our efforts to work together to address a variety of pressing health issues, he stated. One might wonder, why is the U.S. involved in this area of life, in Jamaican culture? But you must understand that there are many Jamaicans that are living in the U.S. and they travel between Jamaica and the U.S. Some people have their family there. A lot of people vacation there. A lot of people work there and live here, vice versa, etc. So, and Jamaica is very, very close to the United States of America. So if there is an pandemic portion of AIDS explosion in an island nearby, it would only make sense for the United States of America to get involved and give whatever help they can to stem the flow of this thing coming over into their immediate USA territories, right? If for anything else at all, that right there alone should make sense. In closing this video, I am going to say this. I am very well aware that there's a portion of our people, and a large portion for that matter, especially of the younger generation, who feel like they are invincible. They can have multiple sex partners who they have sex with unprotected. They start having sex at a very young age and they are uneducated as to the consequences of. You understand? And then they find themselves in these positions. A lot of people are on the fence about getting tested. Some people still believe that the medication that you're given will actually probably start to kill them, as opposed to just knowing that you have it, but changing your diet. People go vegan. People pray about it. Let's talk about religion. People pray about it. There are people that are convinced that if you pray hard enough, if you pray to the Lord hard enough, then you will be healed from this thing. So they believe that through their religion, they can pray the AIDS away. There are other people out there who are maliciously spreading it because they have some kind of an inclination. They're waking up in a puddle of water. They're going through all the symptoms that are listed out there on the World Wide Web. And yet still, they continue to live a wild lifestyle. They're out there, they're meeting different partners, they're not disclosing that they suspect themselves of having it, not to mention those who already know that they do have it, but are having encounters with people who they are not disclosing that they have it. And of course, the part that has been woven into our culture as Jamaicans, sex, everything, right? Sex, everything. So here we are. It's about promiscuity. It's about education. It's about self-restraint and discipline. That's what it's really about. And it's sad that we actually need the U.S. to step in when, in all honesty, the minds of the people is what needs to be reprogrammed. You can't pray away AIDS, okay? And one time that you have a sexual encounter unprotected could be that one time that you catch it. It could be your very first time. So you don't have to necessarily be somebody that is wild and out there. You can have a one-time thing and that happens to you. Not to mention infidelity. Women are cheating on their husbands. Husbands are cheating on their wives. In monogamous relationships, boyfriend are cheat on girlfriend, fiance is cheating on both sides of the fence. And we know that cheating in our culture is very, very high. How do we know? Because there is documented evidence of this. If we should look at how many children actually are given to a different father, thinking that that is their father. You know, when we say jacket a fling, a man get jacket, Jamaica is known to be one of the places that has the highest number of such thing occurring. How that happened? It happens through infidelity. It happens through promiscuity. It happens through having sexual intercourse with someone with no protection who actually got you pregnant. And now, in order to cover that up, your infidelity, you are giving your partner a child that you know really is not his. So these are all things that factor into the AIDS explosion in Jamaica. On a small island like Jamaica, where the population is roughly 2.5 million, to have 36,500 documented. This is documented. So you can imagine how many are not documented. This is 35,000 or 36,500 documented individuals that are living with HIV and AIDS. This is a huge number. A huge number. If we had 36,500 cases of COVID, we would be in a panic. Leave your comments in the comment section below. Tell me what you think about this one and what you think about this program and this $3.6 million US agreement with the CDC that was just signed by the Jamaican government. It's SouFLoTV, man. Like, comment, share, subscribe. Leave your comments up. Wake up, wise up, and rise up. I'm out. Peace.